So what MiVIA does is allows the provider to input any information into the PHR, and then the farm worker has access to that, and also the next provider of care can log on to MiVIA. So out of MiVIA, it started off as for migrant and seasonal farm workers, and now serves, you know, uninsured and, you know, people that, you know, sort of fall through the cracks. From there, the project that I'm most proud of is called HealthShack, and kids in foster youth and transitional age youth also fall through the cracks and also have a transitory life. So we developed HealthShack in 2009 along with our partners at UC Davis and Wind Youth Services and a grant from the Sierra Health Foundation. And we basically built on the personal health record, that platform, we built modules. So the first thing we did is we had this preconceived idea of what HealthShack would be, which was a simple PHR. But then we got smart and shut up and listened to the kids. So we gathered a group of youth, transitional age, homeless youth, kids in foster care, and met with them over a period of 18 months while they were using MiVIA. And they came back and gave us really the lesson and the design of what they needed in a personal health record. And the health was important, but so were my living documents and my important documents, where they've lived, types of foster homes, an education module to store all their educational records, and the jobs module. So actually from HealthShack, you can, because of what these kids did, you can create an online resume just pulling from the database of what's HealthShack. My interest in vulnerable consumers is because, I think for a couple of reasons. One, having Alex, my son, and seeing what he went through, and at least he had his family as a voice, and looking at other people that don't have a voice. And we're very lucky. I mean, Alex wasn't supposed to survive, and he did. So, it's a joy to sort of try and give back in a way. And so what I love is not doing something for other people, but doing something with other groups and listening to them and having a voice, letting them have a voice. And there's a story of a young teenage girl who was with the HealthShack project when we were designing the educational module. She was listening but not talking. And so finally I said, Sarah, you need to tell us, what it is that you want. And she looks at me and says, you don't understand. No one has ever asked me in my entire life my opinion on anything. And so that's just an example of what HealthShack has done. It's not even the product, if you will, or the tool, but the